Hello, I'm Ed Cremata. I'm the Rehabilitation and Nursing Coordinator for Relief Medical Group. Relief Medical Group has a four-course system, and in that four-course system, it starts off with feeling better. A lot of people come to see us because they have back pain, shoulder pain, some sort of pain that they want addressed. And we can provide a lot of treatments for that condition. We have medical physicians, physician's assistants that can prescribe medication temporarily, but that's not really where our focus is. Our focus is on the rehabilitation part of it. Although I'm a registered nurse and that's how I function for Relief Medical Group, I also have 35 years practicing as a chiropractor. So I'm very familiar with spinal problems. I'm very familiar with the correction of the underlying cause of spinal problems. Spinal pain can come from a lot of different causes. This is why sometimes you're better off going to a chiropractor or a physical therapist or a medical provider or a physician's assistant or some other type of provider, because it really depends on where your problem is coming from. It could be a problem with bones, such as with degenerative joint disease as we get older. It could be an acute injury of a muscle that needs to be addressed in a very specific way to reduce inflammation, to maintain motion in the area, have it heal right with the proper strength and balance. It could be ligaments. This is very common with accidents and with chronic problems that you might have had treated in the past for just pain, but the condition keeps coming back, and even if you don't know it, even if you don't have any symptoms, the problems can tend to get worse over time. So what we provide you here is multidisciplinary care. This really is a one-stop shop for you. If you need medical treatment, or medical treatment is the best thing for your specific condition, that's what you're going to get. If you need spinal adjustments, something that traditionally a chiropractor would provide, we would provide that for you. If you need exercise and rehabilitation, we would provide that for you. Whatever it is specifically that you need with more chronic problems, you may have heard of things like trigger point injections, dry needling. All of that can be provided under one roof. The important thing is that I want you to understand is that not only that it's available in one roof, but it's all available as part of a very individualized, customized treatment program for you. So you're not going to get the treatment that a specific provider needs when you walk into our office. You're going to get the treatment that's right for you. And oftentimes it's a multidisciplinary treatment, and that's what works best for you. In terms of what we expect from you is we will expect a little work from you if you want to correct these problems. We will expect you to do the exercises that we ask you to do. Sometimes we teach you some exercises in-house, and then we give you a home exercise program. We will ask you to comply with visits as needed to make sure we get the problem fixed. But the thing that I want you to understand before you start any kind of spinal problem is focus on the correction of the problem. Focus on the underlying cause of the problem and try to fix that, not just don't take the approach of just covering up the pain, because even without pain these things will get worse, and oftentimes you end up needing surgery and much more invasive procedures down the road that if you don't prevent the problems now, if you don't address them properly now. If you have any specific questions about your particular condition that you want answered, there's never any charge to talk to one of our providers. Feel free to call the office at any time at 510-796-2225. And if you want to talk to me personally to get more information or to make an appointment, call my cell phone at 510-913-1366. Thanks for taking the time to listen to this video.